everybody to this segment, because I think typically this is what happens when you talk about health, unfortunately. Is that not correct? When you talk about health, you do not see that many people. And I do not know why. So I'm going to make this as entertaining and as valuable as it's supposed to be for those of you that have chosen to be here. And I believe that you're going to go away with practical and tangible solutions to some of the questions that probably brought you here also. So I want to just welcome the panelists on the platform this morning. Welcome Uduak again and Dr. Dokun. And we are blessed to have very experienced people that can speak to the topic that we are about to discuss. Health is wealth. Have we heard that before? And you know, it's a common thing that we say all the time. Health is wealth. And we know that health is wealth. But again, there are very few people that understand what being wealthy actually means. So let's, just think about it a little. We are here because of the entrepreneur. We are here because people want to make wealth. Isn't that correct? We are here because we are driven by successes. And the main thing that we think about when we gather at events like Fate is how to make our businesses prosper, how to make the bottom line grow. Uduak spoke about the productivity of the employer and the employee. So everybody's mind is geared towards one thing: making money, creating wealth. And yet you are here sitting down and we are saying that it is actually health that is wealth. It's a paradox. I don't know. It's like a contradiction of why you came here in the first place. But I think we are all saying the same thing, because it's only a wise person who understands what true wealth is that is able to value this session and this segment. How many of you have had a toothache? How many have had something that you would think is inconsequential as it should be, you think, as a toothache? Were you able to function? Are you sure? Could you walk? Okay, how about, let me even not use a toothache. You hit your big toe on a table. This one is not malaria. It just happened on a morning that you're about to climb on your 6-inch heels and you snubbed your big toe. And it's throbbing. And you're sitting at that meeting and that big toe is throbbing. Could you pay attention? Sorry? Even Whitlow. So something like a Whitlow can actually reduce your productivity. So are you happy you're here today? You're very happy you're here today. So let's look at why it's important for the entrepreneur to pay attention to their health. And that's really what we're about to dig in, because we notice something in this country. A lot of people are so ambitious and driven by what they want to achieve that they are not paying attention. And I think all we need to do is just take a look around, or even listen to the kind of gist that is coming out of radio stations or what that is being posted on WhatsApp. And you realize that there's a great need for this topic that we are discussing today. It wouldn't take up to a week. You would hear about somebody that went to sleep and didn't wake up, would it? You probably heard of a colleague who came to work and slept and just didn't wake up. We are hearing more and more about people jumping off bridges, young children killing themselves in schools. We are hearing more and more about women who in their homes are so depressed they can't function. And with this our wonderful economy, people are just suffering and smiling. So let's look at this topic realistically. I like being real. So we are in Nigeria, where we should think about health as our wealth. So why is it so important that we would rather spend that 25,000 or 30,000 naira buying a shebi instead of insuring your family with a small amount of money for health insurance? We are a people with very, very weird values. Why is it so important that I deny myself so much sleep, but I would take care of my client so badly that I don't realize what damage I'm doing to myself? Why would I deliver so excellently at my job, and yet I'm ignoring and managing that headache that has been persistent for the past 1 month? We're a country that delights in managing rubbish, unfortunately. So I really want us to be real. See, I'm breaking it down so you can feel why we are here and why this is a passion for me. I left my job to be able to start up a health and fitness company to help people pay attention. And that's why I'm so happy to moderate this session, because this is what I actually choose to do now, because I realized there was a major problem. So I'm going to look at we're going to take this discussion from the wellness wheel, because I think it will help us cover more ground. And I'm so happy to have Dr. Dokun, because he has worked in the government field, and right now he's a spiritual mental health specialist. So we're going to look at hearing what he has to say, because he has experience from, serious segments of that wellness wheel. You've been in the physical space for health. He's been in the spiritual space. He's in the mental space. He's in the intellectual space. And we're going to ask him a lot of questions around that. And Uduak here is in the nutrition space, and she's also in the health medical space, because you spoke a lot about how we should have, regular checks and stuff like that. So my first question is, we're going to look at health is wealth, right? But I'm going to break it up. Health is intentional. Please, when I say this, I want all of you to repeat after me. Health is intentional. So let's look at the intentional nature of health. And I'd like Dr. Dokun to speak to that.
Thank you. Thank you very much. And thank you, Uduak, for the way you started. I like what we're talking about health. And this attendance will show you exactly the importance we put to health. Uduak said something about presentism. About 30 billion pounds is lost in the UK. One thing we all don't understand is this: there is no one who is not healthy that can perform. In the office space, it's a decision you must make for yourself, that I need to be healthy, I need to take care of myself, I need to look after myself, because if you cannot, work will not go, your family will suffer, you will suffer, your business will suffer. Many businesses suffer today in this country because of what we're talking about. People are in the office space, but they're not working. They can't perform. But do we really care? But I'm sure as we go into the discussion, you will understand. Because a healthy person is not necessarily somebody with the absence of illness. It's somebody that has a symphony between his emotional state, his psychological person, and also his the way he responds. Because these are the things that will help him: the way he thinks, the way he acts, and the way he walks. And if those things are not taken care of, there's a problem. That is even from the. But again, as for yourself, how do you rate your health? I say to people when I go to talk, you say health is wealth. And I ask people, do you have a savings in emergency for health? They say, oh, the money is too small that I earn, how can I save? But I say, if you don't save, do you save for Ashwebi? Nobody does. But if your friend comes and says, oh, my daughter is getting married, you pay 5,000 to buy Ankara. If you do that 4 times in a month, that's 20,000, which you never budgeted for, but you don't budget for a health examination of 20,000 naira in a year. So it's a decision we almost sit down to take as an entrepreneur. Even as you wonder about how to get the money, how you get staff to work, how do you manage them to produce and get what you want? It's very essential, and it's something that you must make a personal decision on.
Analyzing what is important to you. So is it important to you as an entrepreneur to understand that choosing life means choosing health? Being productive means being healthy. And therefore, sitting back a little bit and saying, what exactly does it mean for me to be healthy? I found out that a lot of Nigerians do not take that time to sit down and actually ask themselves, what do I need to do to be healthy? So there's ignorance. And I'd like Uduak to speak to that. What have you experienced in your field that has been the greatest barrier that is stopping people from walking the health and wellness path?
So you've said it all. Knowledge is a problem. People don't seek knowledge enough, especially when it comes to their personal health. We have very poor health-seeking behavior in Nigeria. We think when something little is wrong with us, we can easily Google it and find out or speculate and decide which one it is, because Google will give you so many options and you will say, this is the one. And based on that, you begin to do things, and you even do them in a half-baked way. So it's important for us to arm ourselves, equip ourselves with the right knowledge of what is best for us. We are all independent individuals. No two people are the same. It is only someone who has the expertise to analyze your situation that can tell you what is best for you. Nigerians tend to do things in fads. Keto diet. You will join the train. My mates are going jogging every morning. You will wake up in the morning and follow them. Some people have slumped and died whilst jogging. I've lost a friend who was playing tennis. He thought that was the best kind of sport to keep him healthy. But before you start a rigorous exercise, you need to go for a health check. It is only a doctor that can tell you this is the kind of thing that is good for you because this is your personal or individual situation. It is only a dietitian that can tell you this kind of diet will work for you. Not all diets work for everyone. Some people live by the rule of eating right by your blood type. There are different rules out there. You need to understand what is your peculiar situation, and that should determine what you do, how you carry out your fitness activities. It determines what you should eat, when you should eat them. The new thing now is fasting, intermittent fasting. People start eating and stop eating. Do you know what your blood sugar is like? What informed the decision to undertake this intermittent fasting behavior? So it's important for us to always gravitate towards specialists, people who know what they are talking about, those who studied these things, and not rely on what friends and family are doing or what Google says.
In fact, she mentioned Googling, right? Going to the internet to seek for health information. I'm thinking that that's even for those who have phones. Let's be real. What's the first thing a lot of Nigerians do when they have a problem medically? I think they ask the nearest person to them. They will ask if it's their friend or their colleague. There's something disturbing me, and then they start the story. And usually it's happening to a friend. They don't tell you it's about what's going on with them. And then when the person says, I actually drank Forever Living 10 times, and the thing stopped, what do you think will happen? They will go out and go and buy whatever the person said in the conversation without consulting anyone. Okay, so if the person wants to even, take it up a little bit, I think the next thing they'll do is look for the nearest patent medicine store. And you know who is the person manning that patent medicine store? I'm an Igbo woman, so it's fine. And is the Igbo boy that trained under his oga, or a nurse who left as an auxiliary, or in some cases, there are very few patent medicine stores that are manned by proper medical personnel. So you go there and they do missy for you. You know what that is? I'm a pharmacist, so I know these things. So they will mix the blue, the green, and the purple capsules. And in some cases, they'll say it won't work as fast until we give you an injection. And I'm talking about very, very intelligent people going to submit themselves to these things. Okay, so we are even saying maybe that is even medical. How many of you have turned to the abo of this world? Do you know what are in those roots? I'm talking about MDs of big institutions, and they drink what they have no clue is being mixed in them. So what's our real problem? What's our problem, sir?
Interestingly enough, I think sometimes we think it's ignorance, but not necessarily. So I think it's a form of laziness. We do not intend to tax ourselves. We do not intend to interrogate anything. We just want to take the easy route. And that's usually what happens. And just as you said, oh, I feel funny, and then the next person you go to is one maker who sells medication, who says, and the interesting thing is this guy never went to school. He was taught by his oga, who also did not go to school, that when anybody comes and has a headache, this is what you give. And the other thing that I think is, I don't really think we care as much as we say. I don't think so. Because when you look at the things we do, you begin to wonder why we do them. And it's not for lack of education. Even people that are not educated most times behave better, in the sense that they live by experience, they live by... Nobody is saying roots don't work. But the thing is, there is no science behind it in terms of how you use it, how you mix it, and what you do. If there is a science behind it and then people tell you how to use it, people say, take a cup. What is a glass? It depends on the dimension of the cup that you have. I think education like this, like fora like this, will help Nigerians to begin to understand. And also, I think we do not appreciate the importance of health. To me, that is what I see many of the times when you hear people talk about it, and people really don't care. We talk about the cliches. Health is wealth. It's good to do this. We never do. And until we begin to jog people's memory and show them examples of how careless we have been, until then we may not get any result.
And we did say that health is what? Intentional. That's what this section is about. We had to bring out all the challenges so that you'll understand and recognize when they are facing you, that you still have the power to make that wise decision so that the health you are looking for can be found. And so we are moving away from that, which we do. How about the reality of our healthcare system? How can someone who really now wants the healthcare get it? Uduak, can you speak to that?
Our healthcare system is broken. It's difficult for the common man to access good quality healthcare. So sometimes it is important for you to make that additional investment just so that you can ensure that you have the quality of life that you deserve.
So we're thinking solutions now. We've had the challenges clearly stated out. So you want to be the entrepreneur that is healthy. What then can you do? And I want you to pay attention, because for me, this is really why you are here. You've heard about the challenges. You've heard why the healthcare industry is broken. Now, what can you do? How can someone who is faced with all of this, practically, as simply as we can make it, Dr. Dokun, what can you do as an entrepreneur that wants to survive, live healthy, and be able to give your best and be at your best?
You know, I think the entrepreneur must look at the composite picture of what they want to do. You want to start a business, but you can't do the business alone. You need people to do the business with you. And as you are planning and making profit, you also must plan in spending a bit of money in helping the people who work for you and understanding their needs as well. I'm not saying have a hospital or something, but I think today is beginning to get clearer and clearer that HR people, not necessarily the medical people, they must have some ability to understand the working space and understand the people who work with them. As an entrepreneur, yours is not just somebody must appear at work. You must begin to know the pattern of the people who work for you, and then know their lifestyle, get involved in the things they do in and outside the office, because it will impact on what you do. And so the level of involvement must not just be offhandish. It must be, you must be involved in the sense that it's not as if you want to know their private lives, but in helping them to understand. Because somebody, as she said, can be in the office. I see people sit at a computer And they, for 8 hours, you said they work for it, they'll be there for 8 hours, but their productivity is less than 5% because it's just staring at it. If somebody comes late into your office, do you understand why? I'm not saying allow those kind of, but the thing, you must understand the peculiarities of each person and then get involved in their individual lives. For instance, do you know that depression, for instance, is one of the greatest threats to the workspace? And people come. Let me just give you a poster. Maybe I'll ask you. There was this lady, very rich. Her personal wealth was about $150 million. She sold a business, I think about 4 years ago, for about $2 billion. She was married. She had a son. She was doing well, seemingly so. But last year she committed suicide. Gets paid. And just like, look, I can give you an example. Anthony Bourdain. He was in CNN. He was doing very well. He was in Paris to go and cover an event. He committed suicide in his hotel room. There are so many people like that in our offices who are seemingly doing well. The entrepreneur must know. The man who comes, how much of your staff do you know? How much of their private lives do you get involved in? If we don't begin to understand the peculiarity of the human person, not only as mechanical because he works, we'll be missing out a lot. And it's so important the entrepreneur today must shift from the basis of just mercenaries working for you, but for men and women working for you.
Thank you very much, Dr. Dokun, because he has honed it down to two things. As a business entrepreneur yourself, you need to know when to also help yourself, when to create that me time for your own health and wellness. And then also extend it to those who work with you and being supportive of HR to be able to put plans and programs in place to help people to live, so to speak. So what we're saying is it's a gift that you actually can keep for yourself and at the same time give it to other people. But let's look at the busy reality of the life of a Nigerian entrepreneur. They wake up very early. You have to wake up by 4 a.m. sometimes if you have to go into this crazy traffic and commute. And so that's not even the first part of it. You are driving yourself. And sometimes, if you're lucky to even have a driver, the kind of sleep you sleep in at the back of a car cannot be compared to that which is on your bed. And so the person rushes into the meetings, rushes through their day. They've forgotten they didn't eat breakfast. Sometimes they've forgotten they didn't eat lunch. And then they remember by 3 p.m., oh, I haven't eaten. Then they call the office boy. Go and buy me whatever is available. Are you feeling me? And then they go and buy you one oily food from Mama Yabo or somebody who you don't even know the level of cleanliness of the food. And then you're still working because you have a deadline to meet and you're wolfing down the food with your heart racing. Your stomach is churning. And then you finish the food and you have to rush off back into another meeting. And by the time you finish the day, you're back at the traffic. And you're just struggling to stay awake at the steering wheel. You get home by 11, 12 midnight. I want to ask Uduak, lifestyle. What can we do as entrepreneurs? You are hearing what the reality is. What can we do?
I think lifestyle choices are intentional. You need to make the decision to look after yourself. A lot of people do meal preps over the weekend. You prepare your meals for the entire week. You pack them so that it's easy for you to pick one bowl or 2 bowls and you know that that's 2 meals for the day. But you need to create that time to be able to do that. That time that you would have used to go for Owambe, use 1 hour, an hour and a half out of it to prep your meals for the week. If your week is that hectic, be intentional about the things that you eat, even in the workplace, even if you don't do the meal prep at home. What are you buying to put in your mouth? Do you understand the nutrients that are in those things? Do you understand the nutrients that are in your foods at all? You need to be deliberate about gathering the right information to understand what is good for you, which is the reason why I go back to seeking professional help. It is only a dietitian that can clearly tell you that these are the things that for you need to eliminate from your diet, either because of age or because of underlying health issues. And these are the things that are good for you. But lifestyle choices are a choice. There is always room for that choice. And it is your responsibility to make the right choices for yourselves. And also to be able to extend that kind of information and opportunities to the people that you work with. Not when somebody says they want to go and buy food, you say, for what? Sit down, you've not finished what you are doing. See groundnuts, tell there's banana passing. And that constitutes a meal. So, we need to make the right choices.
Thank you very much, Uduak. I just want Dr. Dokun to speak to more on the lifestyle choice thing as per mental health and spiritual health, intellectual health, and possibly emotional health. Can you just talk to us realistically what we should be doing? Work-life balance, because these are realities that the entrepreneurs face.
Thank you. I remember when I first joined Cadbury, I noticed that there was a clinic, but I noticed that there was really no time for exercise or for anything. So one of the things that I pressured the company to do was to start a gym. So I'm sure we were the first company in Nigeria to have a gym. We had a gym, and then we made sure that people come, you attend it either if you're on morning duty, you attend before you begin work or something like that. And then the other thing that I did, if I might say, I noticed that we were making a knorr at that time. I noticed that on every table there was salt. I eliminated it. You don't need salt in any food that is prepared. And I said to people, never add salt to whatever food has been prepared for you. Then I noticed that people were sneaking in knorr to come and crumble. So I put security at the doors to stop that. And the thing is, if you don't get involved in this thing, people get away with blue murder. The woman that was managing the canteen would rather buy eggs instead of meat. And said there was no meat, so she was serving adults 2 eggs a day. And I stopped all that. You see, as we have said, the issue of health is intentional. We just must get involved in it. Let me also now veer into mental health. People think that if you go complain to a doctor about your mental health state, it means that you are mad or that you are sick or they're a weakling. It's not true. If you understand in this country today that bed space is taken up by people who present with psychosomatic illnesses, it's not that they're really ill, but the problem is they have emotional problems that are now exhibiting themselves in headache, in body pains, and all that. About 7 out of the 10 beds in hospital are taken up by conditions like that. And look at Nigeria. The first Nigerian mental health policy was enacted in 1991. Wow. And today, just 91. There was one from the British in 1950s, but the Nigerian medical health policy was 1991. In this country, we have only 100 psychiatrists. 100 psychiatrists. And then we have only about 8 regional hospitals to take care of mental health. And the thing about, if you look at today, the various issues in mental health, one of them is depression, anxiety, and then the one that is gaining currency today is substance abuse. Many of us are sitting in the office where we don't know that many of our staff are on drugs. Let me just run some statistics by you by UNODC. They found that globally about 35 million people use substances. 15 million of them live in Nigeria. The global 15 million of the 35 are Nigerians. The global prevalence rate of substance use is 5.6. Nigeria is 14.4. The global use is 1 in 20. That is, if I have 1 in 20 people globally, one of them will be on substance. In Nigeria, is 1 in 7. 1 in 4 women use substances. These are facts. These are statistics. But it takes us back to, you see, when a man is frustrated, when they are under stress, what do they take to alcohol? Substances, they pop pills. Today, if you know the variety of substances that can be abused, you'll be shocked. You're a pharmacist, you know. People will take codeine, mix it with Coca-Cola, mix it with Lacasera, cough syrup. And you know, I mean, even to non-synthetic things, like I don't know whether many of you know about what is called gegemu. Gegemu is a local plant that people plant to drive away snakes. Today, people abuse it. I mean, we need to wake up as the people to begin to appreciate the issue of health and mental health. We are running in a danger in this country because we're still lucky. America, somebody will wake up, pick a gun, and kill 50 people. We don't have that yet, but we have a molo driver who's just taking something and runs people into the ocean. I think as a people, we must take the issue of health very seriously, the issue of mental health very seriously, and that is, it comes to how we live our lives.
Thank you very much. We have a few questions on nutrition, and I would like Uduak to address them. I would just give you the microphone.
All right. So there's a question here about how can we bring down the price of healthy food in Nigeria? Did we get that? How can we bring down the price of healthy food in Nigeria? Now, cost is relative. What is pricey? It depends on your pocket. Where are you procuring your healthy foods from? Some people have limited budget, but still want to shop where the affluent ones shop because it's aspirational. You also want to go to ShopRite. I think increasingly we need to patronize our indigenous foods. We have so many healthy, nutritious, indigenous foods. Some of them are forgotten. Some of them are lost. Sometimes the market is too messy, so you don't want to go. That is where the affordable food is. That is where the organic food is. The non-GMO foods, they are local foods. The ones produced by our local farmers. Forget the things that you see nicely packaged. Value has been added to them. They've been washed, they've been cleaned, they've been packaged. You don't know the sources of most of those things. So the more we try to patronize our own local produce, it is cheaper on your pockets, it is better for the economy. Because the farmer who produced that thing is also an entrepreneur. So it is also good for business. So there's another question here about building nutrition. Okay, how does an adopted child, an infant, get the nutrients or the nutrition that he or she requires to be a healthy adult? Now, when you say an infant, I'm not sure the age range. Is it a child below the age of 2?
I think it just speaks to maybe you're not sure if the person was breastfed. You know, it talks
Yes.
about the breastfeeding, if not done in
Oh,
the
yes.
first 1,000 days.
1,000 days.
So I think the question speaks to, will they still be, effective adults?
It
or
comes at an
mature
additional
adults?
cost. Breast milk is free, and it is the best for the child. There are other nutritious foods out there. There are alternatives, which is the reason why you don't have a complete elimination of breast milk substitutes from the market. They are there, but they come at a high price. So it is possible, but it requires some additional financial investment. And it also requires the right support from an expert pediatrician to be able to guide you through the process of being able to nourish that child so that they get the micronutrients that they require for the adequate brain development.
Thank you very much, Uduak. And I just want Dr. Dokun to speak to, because I have a couple of questions that is asking if there's anything at all in your experience that government is doing to deliberately put policies in place, whether for the worker in the workplace, to have like regular mandatory checks or mental health focusing of support, where, these days people are scared of telling the employers, I'm ill. When everybody is scared of losing their job because you don't want that to become a reason to retrench you before your time. So is there anything at all that you know that is happening in that space?
Nigeria is not deficit in policies or rules and regulations, but it's compliance that is the problem. In Nigeria, for instance, as I just said to us, the Nigerian mental health policy was only introduced in 1991, although there was an archaic one in the 50s, But many times we do not domesticate those things to accommodate our culture and our people. And the thing is, there are certain things that each workspace must adopt within the concept of the complete picture. In the sense that, I mean, again, I come to a personal example. When HIV came, I had to work on a workplace policy for HIV in my company, which was then adopted globally. We must come to a place in which professionals even appreciate the importance of the things they're working on. And I think the time for HR to expand its knowledge, its frontier of participation in the workplace is now here. The HR, what I see or what I saw before, HR people are just people who taking people, fire them and all. That is no more HR policy. The HR policy must understand the workplace. What are the things to make the workplace conducive to the worker? What are the benefits to the things we do that make the workplace good? So in terms of policy, yeah, there may be a national policy, but how do we bring it into our various companies? How do we make it work for the ordinary man? If, for instance, somebody gets up and you know the person has a psychiatric illness, do you report him to management so that he can be excused, or do you get him treated that he can be accommodated in the workspace if he's not violent and if he takes his medication? Oh yes, he can function. So it comes to a complete understanding of the human person and how we need to offer support. I think every workspace, I think it was Uduak who talked about breastfeeding. By the time I was leaving Cadbury, we had a crèche, a little crèche, where women also can come and bring their children. They can come later and then breastfeed and go back to work. And we also introduced something we call paternity leave. And when a woman delivers, the first 5 days after delivery is very important. So we allow the husbands to stay at home with them at no cost to them, and does not remove from their leave period. So I think it is a matter of understanding how you need to contribute to the health of your staff to help with the policies.
Fantastic. And I think it's important to know that as entrepreneurs, we are business owners. We are actually the ones that are going to make this change happen. After attending sessions like this, you determine that you will make your own office or workplace or factory friendly to health. And this is where my passion lies. I said that we run a health promotion company called Fitness Fair. And I have a few questions that I think are just in my turf. Because somebody is asking questions about, is there anything the government can do? We have all heard that there are so many things that is unregulated in this country. If you are speaking to bringing change, it's still the individuals who make the decisions in their own environment that can make that change happen. One. Then two, the power you have is in making the decision to say, I'm going to make sure I bring corporate wellness. If you are an employee in an organization where you are in HR or you have the ear of the HR person, we work mainly in the corporate wellness space. And we have so many companies that are beginning to understand how important this is. And almost every Fortune 500 company abroad has a department now for corporate wellness. That means they're not just looking at handling this thing like something that HR is doing for someone as a favor. They're actually implementing policies that speak to making sure the work environment has the all that is needed. Some have nap rooms where if you're tired, you actually go and take a nap. Some have healthy snack sections in the lunchroom. So if you don't want to eat this food, you have options to stick to your salads or whatever. And some create exercise rooms, gyms in the workplace. You go there, you work out after close of work before you hit the traffic. But they implement and put certain things in place. I just want us to go away knowing that we are empowered and there's something you can do. And if you can't do it in your own place, do it where you are working and begin that change. The second thing is someone asked us about sleeping. How can you know when you're sleeping? There are different trackers available. I'm wearing one. Uduak is wearing one. These days, there's hardly anybody who doesn't. I can tell you how many hours I slept. I can tell you how many steps I've walked. It's cheap. I want us to go away knowing that we have the power. First of all, the information you get, yes, it may not be from a core professional, but there are common sense ones, for goodness sake. Like, you know when you are eating healthy. Choose that which you know. I always say this when I go to speak. I say, why did God put Adam in a garden? People, why? Because he knows, and he knows till tomorrow, that the best foods for us are the natural things. So if there is a reason why God put Adam in a garden, why are we insisting on eating? In fact, where did you see the first poultry or the first ranch that meat came into the world? These things are allowed, but the first and basic is your garden. If you can just think in that common sense way. And then I ask people, just think about breakfast, think about lunch, think about dinner. If Adam came to eat in your house, what would he find to eat? Just think about it. Think about your plate for breakfast. He will not recognize bread. He will not recognize the tea you're drinking. I'm just being real. What is it that if you set on a plate now, you would say, Adam, take this, you recognize it. What we are eating these days is not even food. So let's try and think common sense. A lot of these things are things we can do. The sleep part, the drinking water part, the exercise part, you all know. But let's make that choice. Life is a choice. Life is intentional. Health is wealth. Thank you, everybody, for joining us in this session.